Dyslexia is a specific learning difficulty that affects reading and language processing. It is estimated that about 5 to 10% of the population worldwide has dyslexia, and 90 million people in India are estimated to have learning difficulties. Among that, 10% of children in India are estimated to be affected by dyslexia. Hello everyone and welcome to Saadya Educational Trust special Q&A session on dyslexia. I'm your host for today's insightful discussion. Today, we have privilege of sitting down with a renowned expert in the field of dyslexia. Together, we'll explore this often misunderstood word dyslexia, which is nothing but specific learning difficulty. So whether you are a parent, educator, or simply curious about dyslexia, you are in the right place. Let's dive in. Hello ma'am, nice to see you. Before we talk about learning difficulty, please can you introduce yourself?
My name is Ramamani. I did my bachelor's in education in the year 1987 after my BSc, 37 years ago. Further, I did diploma in learning disability in 2004, almost 20 years back.
You have translated a book called Learning Difficulty from English to Kannada, which is written by Banjara Academy director Dr. Ali Khwaja. In the book, the author talks about learning difficulties. In the first chapter, he also talks about emotional difficulties. So according to you, what is the difference in approach towards children with learning difficulties earlier and now?
When I studied bachelor's in education, learning difficulty was not covered in the syllabus. Children were categorized into three categories with respect to learning: below average, average, and above average. The question papers were also set to address the needs of these three categories of children. Children below average were struggling to get through the exams. Many students had to repeat the class. Some of them had to discontinue the school or college in the middle. I feel expectation from the parents were comparatively less those days, and the competition was also less. Hence, it appeared to be of not a big issue that time.
How did you get interest on the subject of learning difficulty?
Like any other parents, my expectation from my daughter was high, but my teaching techniques were not sufficient. Social media played a big role in bringing awareness about this subject, dyslexia. After her assessment, we started to gather information regarding available teaching, learning techniques. That is when I found an organization called KPAMRC, that is Karnataka Parents Association for Mentally Retarded Children. Now it is called KPACIDD, Karnataka Parents Association for Children with Intellectual Developmental Disorder. I completed 10 months diploma course. This I did while in service. By the time my daughter was in 10th standard, I was equipped with the skills necessary to teach effectively. It paid off brilliantly. Her confidence level grew multiple levels. She got through 10th CBSE exam with unimaginable percentage.
What were your challenges in handling a child with learning difficulty?
As a working parent, time was a big challenge. One needs to be creative and customize, individualized the teaching to the needs of the child. The second one is awareness was very low. We had to educate teachers, including principal, about the little known condition called dyslexia, and the update information of the provisions, exemptions available at the government level for writing exam. The most important of all these is the knowledge about the assessment reports and the centers authorized to give such reports, and duration of time taken by the school in granting such provisions to the students.
Then, how is the situation now?
The awareness has improved, but not to the extent it should be. There is resistance from parents, teachers, and institutions in accepting every child as whole and complete. They are looking at it as a problem and expecting quick results. This is not possible as every child is unique. Especially children with intellectual difficulty needs individual attention and guidance.
What changes do you expect in the education system so that the situation can be addressed?
The only change is to identify the difficulty in the lower classes and giving individual attention to such children in every school. Though it is there in government policies, I feel it is not being followed strictly.
What does Saadya stand for and what is its vision?
Saadya stands for spreading awareness about dyslexia and autism. We spread awareness about dyslexia and autism by giving free training to the interested parents and teachers, and also we conduct remedial classes for children assessed with having specific learning difficulty.